Diabetes mellitus type 1. Group members: Campisi, Anthony Nguyen, ANDREAS PISTEVOS, SHANTA SHAHI, and Tran. Pathophysiology of the patient diagnosis. Within the body, pancreatic beta cells are responsible for producing the hormone insulin, which regulates the body's ability to control blood glucose levels through the signaling of the liver, muscle, and fat cells to increase uptake of glucose from the blood. Type 1 diabetes is a disease that leads to the impairment of such pathophysiological processes, disrupting the normal regulation of blood sugar levels. Within the body, antigens play a crucial role in distinguishing of cells from self and non-self. When cells are recognized as non-self, the immune system is activated, and the cell is destroyed via antibodies. However, in some individuals, the bodies cannot recognize their own pancreatic beta cells, which results in the activation of the immune system, leading to chronic immunological responses. As antigen-presenting cells are delivered to the immune system, the production of antibodies begin that specifically target the pancreatic beta islet cells, as they are not recognized as self. This leads to the destruction via a range of cells, including cytotoxic T and B cells. After this destruction, the pancreas is devoid of most pancreatic beta islet cells that are incapable of regeneration, resulting in an insufficient amount of beta cells left for the production of the body's insulin hormone. This causes a decrease in the body's ability to convert glucose within the blood to energy and thus leads to the development of type 1 diabetes. Risk factors associated with the diagnosis. The exact cause of the autoimmune disease is actually unknown, although studies have found risk factors that are closely associated with the disease, including genetic and environmental factors. Individuals with specific genetic expressions will have a higher risk of type 1 diabetes in comparison to other individuals due to the development of the disease. As mentioned in the prior slide, human genes play an important role in the identification of cells as self and non-self. Inheritance of specific genes such as certain HLA alleles increases the probability of the immune system attacking its own cells as a result of a change in identification. Consequently, destruction of pancreatic beta cells occurs, leading to the development of type 1 diabetes. In addition to this, there are a wide range of environmental factors that play a role in the development of type 1 diabetes. These factors that normally occur during early stages of life lead to the alteration of the immune system and thus beta cell autoimmunity or destruction. Some factors that have been researched so far include gut microbiota reduction, obesity, early fruit induction, early bovine milk induction, glutens, toxins, vitamin D deficiency, and viruses. Certain viruses in particular have a strong association in the development of type 1 diabetes when individuals catch them during neonatal or infancy stages of life. Signs and symptoms of type 1 diabetes. A symptom of type 1 diabetes is frequent urination, also known as polyuria. This process occurs due to high amounts of glucose within blood, which causes the body to attempt to excrete the glucose through urine. Glucose, however, has osmotic diuretic properties, whereby when there are high amounts of it in renal tubules, it will cause water to follow it, forming more urine and increasing the urine output. Another symptom of diabetes is excessive thirst, also known as polydipsia. This is caused by high amounts of glucose in blood, leading to an increase of blood osmolarity. As a result, the pituitary gland in the hypothalamus releases ADH, antidiuretic hormone, which also makes the body feel thirstier. Another symptom is excessive hunger, also known as polyphagia. This occurs due to the lack of insulin produced due to type 1 diabetes, whereby glucose isn't utilized by cells of the skeletal muscle to produce any energy. This lack of energy consequently causes an increase in hunger. Another symptom is blurred vision, which is caused by a lack of insulin. Insulin plays a critical role in endothelial function, specifically the production of nitric oxide, NO, which controls vasodilation of a blood vessel. However, lack of insulin will therefore cease the production of nitric oxide, stiffening blood vessels in the eyes and damaging it, consequently causing blurred vision. A sign of type 1 diabetes is weight loss. This is closely related to polyphagia. Since the body is experiencing more hunger, it will cause muscle cells to obtain energy from the mobilization of adipose tissue to make energy. Furthermore, insulin is meant to increase protein synthesis and decrease rate of protein degeneration. However, due to the lack of insulin, this will cause the rate of protein degeneration to increase, leading to weight loss. Similarly, fatigue or weakness is a symptom and is caused by lack of insulin. Therefore, glucose uptake by adipose tissue and skeletal muscle won't be effective, reducing energy production. Diagnostic testing. Diagnostic testing for type 1 diabetes typically consists of glycated hemoglobin A1C test, or oral glucose tolerance test. The glycated hemoglobin A1C test records average blood sugar levels over the course of 3 months, measuring the percentage of blood sugar attached to hemoglobin. Over the 3-month test, results of blood sugar levels are then interpreted to determine indications of type 1 diabetes. The higher the results are, the more sugar is attached to hemoglobin in blood. If A1C levels are equal to or more than 6.5% on 2 separate tests, diabetes is then confirmed. This test provides an understanding of the disease processes as it identifies how consistently high blood sugar levels caused by insulin deficiency affects the hemoglobin, allowing for the measurement, progression, or severity of the disease. Another diagnostic measure is oral glucose tolerance test that measures an individual's blood glucose levels after fasting. A total of 2 sets of the tests are performed to ensure that there is adequate proof in determining cases of type 1 diabetes. If both tests present higher than 7 millimoles per liter, it indicates about diabetes. As mentioned previously, type 1 diabetes often leads to higher blood sugar levels as a result of deficiency in insulin that normally regulates blood glucose levels. Urinalysis is another test that is also used to evaluate severe hyperglycemia that may be primary to type 1 diabetes by identifying ketones in urine. Ketones are a metabolic byproduct produced in the conversion of fat to energy when there is not enough insulin to convert regular glucose to energy. In type 1 diabetic patients, this occurs as there is an insulin deficiency as a result of the destruction of cells that are responsible for producing that hormone that regulate normal glucose levels. High ketone bodies indicate that there is an insulin deficiency and may also lead to diabetic ketoacidosis if not addressed. As type 1 clinical management. As type 1 diabetes is not a curable disease, it is best managed by effective glycemic control and prevention of secondary complications. Some methods include blood glucose monitoring, nutritional therapy, and insulin therapy. It is important for individuals with type 1 diabetes to monitor their own glucose readings throughout the day to determine suitable insulin usage and/or diet supplementation. This is important as blood glucose levels increase and decrease throughout the day, varying off exercise, food intake, and a range of other factors. This method is essential for individuals with type 1 diabetes as it is an effective management strategy to treat the disease processes relating to insulin deficiency and to avoid secondary complications, such as hyperglycemia or hypoglycemia. Adequate nutrition is another management strategy that should be utilized by individuals with type 1 diabetes. It is important for these individuals to have a balanced diet while also taking note of their carbohydrate intake. This allows individuals to determine whether they may be at risk of hypoglycemia or hyperglycemia following a meal, due to the impaired ability to produce insulin. Insulin therapy aims to mimic normal pancreatic insulin secretion through normal basal bolus therapy, multiple dose injection, or continuous subcutaneous insulin infusion methods. The administration of insulin through these methods enables the body to function at normal levels as insulin deficiency of the disease is addressed, thus preventing signs and symptoms of the disease from occurring. The insulin also addresses hyperglycemia and thus signs and symptoms associated. If these strategies are not managed properly, it can lead to diabetic ketoacidosis, DKA, resulting from severe hyperglycemia, which will be discussed into detail on the upcoming slide. A clinical management strategy for DKA is IV fluid replacement, using a range of fluids that include insulin to help restore intravascular volumes lost from frequent urination, lower blood glucose levels, and stabilize hyperglycemia. Medication management. In type 1 diabetes, there is limited production of insulin for the body. Therefore, symptoms such as polyuria, polydipsia, and polyphagia occur. In order to manage this, insulin can be administered to a person who is diabetic. Insulin is a common medication in the management of type 1 diabetes in which individuals must take to reduce their blood sugar levels. There are a wide range of insulin types that individuals can take depending on the current situation. Some examples of insulin include short-acting, rapid-acting, intermediate-acting, long-acting, and combination. Insulin therapy is initiated in order to maintain glucose at target ranges, 4.44 to 8.33 millimoles per liter, and supply enough insulin to carry out bodily functions. Therefore, through insulin, symptoms like polyuria, polydipsia, and polyphagia can be managed. Types of insulin are short-acting insulin, which is given as a bolus dose and is injected pre-meal to reduce postprandial glucose and ensure that glucose levels are within healthy ranges post-meal. It is also known as regular insulin and has an onset duration of 30 minutes with a maximum effect occurring between 2 to 5 hours following administration that lasts for 6 to 8 hours. Rapid-acting insulin is also given as a bolus dose and has an onset of 15 to 20 minutes pre-meal. The function of this insulin is similar to short-acting, although the onset time interval is more optimal for patients that are also prescribed other injectable medications that needed to be taken within the same time frame. Additionally, patients who are unsure of the carbohydrate levels in certain foods can use this to allow for more accurate dosing and reduce the risk of hypoglycemia. Intermediate acting insulin is given as a basal dose and has an onset of action at 1.5 to 2 hours. Its maximum effect is at 6 to 14 hours and has a duration of 10 to 16 hours. Basal insulin will maintain glucose levels at target ranges for a long duration, and thus is only given once or twice per day. Long-acting insulin is given as a basal dose and has an onset of 3 to 4 hours, while providing a constant release for 24 hours or more. As it is a basal dose, it also prevents ketogenesis amongst patients with type 1 diabetes. Combination insulin is a premixed insulin containing a rapid-acting or short-acting insulin mixed with an intermediate-acting insulin. An example of an insulin regime to prevent and manage these common symptoms is a long-acting insulin, for example detamir, given once a night as a basal insulin to help glucose levels stay constant. Additionally, rapid-acting insulin Lispro is given before meals to reduce a high fluctuation of glucose after eating. This ensures that glucose targets are reached and are maintained. Complications. Type 1 diabetes can lead to complications, both long and short term, if managed incorrectly, either through poor medication compliance, high energy diets, etc., leading to the damaging of body parts and systems. Long-term complications include neuropathy, retinopathy, and nephropathy. In neuropathy, nerve damage occurs as excess sugar damages capillaries that provide nutrients for nerves. Over a prolonged period of time, especially with uncontrolled blood sugar levels, tingling, numbness, and pain can begin, eventually resulting in the loss of feeling in affected limbs where the blood supply has been lost. Retinopathy can arise due to prolonged durations of excessive blood sugar levels. It is categorized into two individual types, non-proliferative and proliferative. Non-proliferative complications include microaneurysms, retinal hemorrhages, and exudates developing that cause damage to the eye and potentially leading to blindness, as well as increasing risk of cataracts and glaucoma. Proliferative is the development of new blood vessels, which is introduced as no proliferative retinopathy progresses. Neuropathy damage to the kidneys can occur due to filters being damaged by high glucose levels in the body. Eventually, this causes protein to enter normal urine and possibly the development of end-stage renal disease due to the dysfunction of the kidneys. Short-term complications may also include unintended weight loss, fatigue, and lethargy, all resulting from insufficient energy levels in cells. Blurred vision, which is also an early sign of retinopathy damage, occurs due to high blood sugars that cause swelling and thus blurring. Diabetes ketoacidosis, DKA, is another complication categorized by hyperglycemia, ketosis, acidosis, and dehydration. When there is a lack of insulin, the body cannot properly use glucose as energy. The body reacts by breaking down fat and using it as fuel. Ketones, an acidic byproduct of this process, can build up within blood and lead to serious complications. If untreated, it causes severe depletion of potassium, sodium, phosphate, chloride, and magnesium, which are all essential nutrients in the functioning of the body. Thank you.